back, everybody, to another episode of the Nonprofit Show. You know, I'm really excited about this conversation because we're going to be talking with Barb Clapp, CEO of Dwyer Workforce Development, but we're going to be talking about kind of building a new nonprofit model. Say that fast 3 times. Barb, I can't wait to hear what you have to say. Welcome.
Thank you. I'm excited to talk to you. I love what I do and I love sharing the journey. So thank you for giving me this opportunity.
Well, this is a really cool thing because I feel like you've got a lot of things going on. You're a relatively new organization. You're doing new things in multiple places, and wow, it's a huge lift. And so I can't wait, to get into this with you and really understand how maybe other nonprofits can look at this. We have amazing nonprofit sponsors that allow us to have these conversations. We're coming up on our 1400th episode next Friday, which blows my mind, but it's true. And we are here because of our presenting sponsors. They include Bloomerang, American Nonprofit Academy, Staffing Boutique, Holdings Nonprofit Banking, Interim Executives Academy, Your Part-Time Controller, Fundraisers Friday, and JMT Consulting. I'm Julia C. Patrick, CEO of the American Nonprofit Academy. I want to give a quick plug to our newest book, The Architecture of Fundraising. This is a collaborative effort between one of our other co-hosts, the amazing Tony Bell, Mr. Nonprofit Consultancy, and you can pick it up on Amazon. It's a great read, and it really gets into the back end side of fundraising and how it works and how you can be successful with it. Okay, Barb Clapp, welcome to the Nonprofit Show. I've been so interested in hearing about your work and your story. If you could share with us about your organization and kind of the genesis of it, if you will.
Sure, absolutely. So our organization, our mission is to help people who lack opportunity and to improve the healthcare staffing crisis, as well as the community at large. It was the brainchild of a gentleman named Jack Dwyer, who was a longtime client of mine when I owned a company that I sold, and a national communications company. And after I sold my company and had my earn out, Jack asked me what I was going to do. And I said, I sold my company so I could run a nonprofit. And he said, I'll call you tomorrow. And that was an incredible call. He's an entrepreneur and I'm an entrepreneur. This is the third thing I've started in my life. And Jack and I had gotten to know each other very well. He's incredibly philanthropic. He cares deeply about people who lack opportunity. And he also is very concerned about the catastrophic healthcare staffing crisis. He has several companies, including a bridge to HUD lending company to healthcare. And so he's very aware that one of the biggest threats to any kind of healthcare is this catastrophic healthcare staffing crisis, the tsunami of aging people and not enough people to take care of them. So he asked me if he could call me. He called me and he said, listen, it's going to be great. You're so much fun running this nonprofit. And we're going to help people that lack opportunity. We're going to fix the healthcare staffing crisis. And I think you'll be perfect. So that's how it started.
It's such an interesting thing to hear this behind the scenes story. And so I love that you spent some time with us because I think it's going to help frame up our conversation. I find that folks that come into our sector with a different background and that diversity of thought, action, and deed really brings some exciting things to the table that didn't exist. And I've got to ask you before we ask our first question, did people tell you, oh, that'll never work?
No.
Okay, good.
People know if I'm going to do something, it's going to work no matter what.
I love it. Well, then that's even better. That warms my heart. That really does. So the starting point, you have a man and a family with passion, understanding, that there's this silver tsunami, this crisis of healthcare staffing coming down the pike. It's going to impact us across the nation. How did you start to understand what you needed to do when it's such a vast problem?
Well, first of all, when I had my national communications company, my emphasis was on education, healthcare, not for profit, government, and corporate accounts. And I had a lot of experience working with nonprofits. I also have served on a lot of nonprofit boards throughout my life. So I kind of knew what it took to make a nonprofit successful. But also, because I had a communications company, I knew I told people how to position their businesses, and I told them what their main product was and how to grow it. So it was real easy for me to come in here and figure out what were the next steps for this nonprofit.
Yeah, really interesting. I mean, I love that background, and we'll talk about that even more because what a gift. So often I see organizations have a great heart and a great mission, but they stumble out the gate because they don't understand the process and the strategy that goes behind a great mission.
Yeah, I've seen it a ton in my lifetime, and it's not just nonprofits that
Yeah.
get to that place. It's also the corporate world. I just think that people have great ideas, but they don't know how to position them or execute them or make other people buy into what they're trying to do. And sometimes their idea isn't great, and they don't really know what their product is, and then they that makes it even more difficult to position it.
Right. It's a great observation. Let's talk about this journey towards a national impact. This is what I find so fascinating from spending some time on your website, looking at that heat map of where you've grown and how it's gone. Um, they're not exactly communities that are all the same. They're pretty varied, it seems to me, in terms of the complexity of our nation. Um, the mission and the root issue that you're chasing is the same, right? I
Right.
mean, healthcare and training and workforce development. But talk to us about moving through a concept as a startup and pushing it out on a national level. That seems pretty ambitious.
So I'm in Maryland. I live, my
Okay.
home base is Maryland. And because I had my company, I was very familiar with people in the DMV. And, one of the things I had to think about is where do I get these people to train? We are not trainers we train people to be CNAs, but not in-house. We use outside trainers. So who's going to do it? How are we going to do it? How are we going to set it up? Because literally there was nothing when I walked in the door here. But I called on the resources that I had in place here and started calling on other nonprofits to send us their people who needed jobs. And I sort of like capitalized on the resources I had, and it was very quick. The first part of the time I was there, though, Jack had an idea. We're a social enterprise. I not only run this nonprofit, but I also run another large business in Texas, and it was a portfolio of skilled nursing facilities, and I led a $590 million acquisition of those facilities. I turned them into nonprofit facilities committed to employees, residents, and the community, and rebranded them. And we have it was a huge deal, as I said, and the money that they throw off after deal covenants helps to fund this workforce development program. So it made sense for me to go to Texas next, and then from there, we were also targeting states where we were supported by the different governmental entities where we could get money right away. And because I have this kind of insurance policy in the Texas portfolio, I was also able to start tapping into earn grants and that kind of thing. So then next was Florida, and Texas and Florida and Arizona, where you are, I think, have just this grain of America, and people are moving there like crazy. So it made sense to go there. And then for other reasons, Kansas actually contacted us. And to go into a new state, we have a very set criteria, a set of criteria. They contacted us and they met the criteria. New York reached out to us, and it's just grown from there. So we're in 7 states, and we plan on going into 5 more next year.
Amazing. I heard something really magical from you, and that is that you had established your own criteria that really led the way of expansion. And I love that because I think a lot of times we get so enamored by somebody loving us or wanting to partner with us that we're just like, we'll do anything. We jump in before we've really evaluated if it's a good fit.
Well, it's interesting because I did get some national press initially, and the people in Kansas, they have this incredible group of people called Justice Matters. And they had, every year they try to figure out what is the thing that's facing Kansas that they need to deal with. And the first year I started this, they identified the aging of America and no one to take care of them. And they also actually care about people who lack opportunity. So they saw the press and they reached out to me and said, I'd like you to come to Kansas. And I was in the middle of leading this acquisition, starting this nonprofit from scratch. And I said, I'm not coming to Kansas right now. I appreciate you reaching out. And they said, what do we have to do to get you to come to Kansas? And so I sent them the list of criteria, which seems daunting, believe me. And they achieved it. And my COO said, I have bad news for you. I think we're going to Kansas because they just sent all the criteria in an MOU. So
I love it.
I got to live up to my word. So we went to Kansas, and they're great people, and we love being there.
It's such a fascinating thing because I feel like in the nonprofit space, when we think about growth and when we think about the trajectory of how we can spread our mission, a lot of times we're so focused in on ourselves and our own capacity and not our partners. And I love your model. I love how bold it is to put it back onto those partners, because I've got to believe that you have elevated your opportunity for success tremendously, right? Because everybody understands what needs to be going on as opposed to trying to figure it out. Like, oh, just get together and we'll figure it out. Which tends to be the model.
Yeah, that's not our model. The other thing is we have all kinds of partners that we rely on to get the job done. We have referral partners, we have training partners, we have employer partners, and the list goes on. And we're very, very strong about what our expectations are from our partners. And we have people sign MOUs with us. So that we also, we're really focused on not only people that lack opportunity, but we're focused on changing this healthcare staffing crisis. And because we set expectations of our employer partners and of our training partners and our referring partners, we have definitely seen both parts of our mission begin to be accomplished. We've trained in the short period of time since I was funded in September of 22, 10,000, we just got to 10,000 Dwyer Scholars. And, we're in the 7 states. And, what we've seen is when we have these expectations of our partners, our outcomes are insane compared to most outcomes in the country. And we understand that there has to be boundaries and standards, and to do this right, we have to be good partners to them as well.
Right. Barb, we had a guest on earlier this week, and she said something that was very subtle, but really meaningful to me. And she said, clarity is kindness. And her comment was that when we are clear about our expectations, what we expect of ourselves, our partners, even our donors and our stakeholders.
And our team.
Yeah, and our team. You're right. Thank you. Then we can all navigate more quickly and efficiently, knowing what we have to do. And I just was like, yeah, it's such a basic thing. And I don't know why we forget it. We tend to until we have a problem, then we kind of circle back to that. But I love that. It seems to me you innately have that understanding.
It resonates me. What you said also resonates with me. It is kindness. Clarity is kindness. And I'm like a straight shooter. So no one really doesn't understand what my expectations are.
Yeah, I love it. You briefly mentioned this in the beginning, and I want to spend a little bit more time on you bringing your talents and your wisdom of communications, understanding national communications, not just regional or community communications. Talk to us about how your strength and your background in this specific area has really impacted the organization and your meteoric growth.
So my little motto is that press brings opportunity, and having a consistent brand and understanding consistent messaging will improve outcomes. I completely understand that. And it's funny, when I had my communications company, I'd have very successful business people say to me, I built a $10 million business and I never used any communications tools. And I always said back to them, it probably would have been 100 million if you had actually used communications tools. I think that having a good communication strategy and spending the money on it in a efficient way brings so many things back to the organization. And I actually worked with one of the best comms people I've ever worked with in my life when I had my company. And after my earnout and my non-compete was over with, I went and sought her out and I got her here, and she has been essential because she understands my strategies around comms and what I believe. And we believe also that your comm strategy is internal and external.
Yes.
Your team has absolutely got to understand what your values are, what your mission is, what your goals are to accomplish that mission, what your expectations of them are, and how they communicate it back to other people. And then your outside, your external comms, they're not going to give you money if they don't see value. And the only way they see value is if you project the messaging that brings the idea to their mind that, yeah, this is something I really want to support.
Yeah. I love that you brought up the internal versus external. And I've got to believe that for a national organization such as yours, this is even more critical given that you have varied cultures and parts of this nation working in the same direction. Talk to us a little bit about that. I mean, do you have different communication strategies for each state, or do you just pretty much try and keep it consistent?
So our messaging is always consistent, and we always are rowing in the same direction that way. But you have to actually understand your markets to be able to efficiently communicate to them. So I'm in rural areas, I am in suburban, urban, and each market does require a different methodology in the way that you communicate to them. And when you kind of, as we say in the nonprofit world, meet them where they are, which you usually is who your client is, but it's also your comms, your target, your comms target. They understand it better. And of course, I'm in areas where people speak different languages, so it's different, and we really fine tune it. We also fine tune here. Our whole motto here is, while I have all this criteria and rules. I also say that not one size fits all, because you cannot solve systemic poverty, a healthcare staffing crisis, and change people's lives if you can't make the model flexible to the needs of your constituents.
Right. I love that. I think that takes a lot of humility to understand what it is you don't understand, right?
Mhm.
And to
Mhm.
help navigate that communications piece of it is just really arduous for so many organizations.
It
Um,
is.
I also think it's interesting what you mentioned about, the business owner that's like, I've done this word of mouth and didn't need any communications. I hear this from nonprofits who get pressure from their boards who say, well, that's ridiculous. We shouldn't be spending money on marketing. They're probably the same ones that say we built our business without,
Yeah.
marketing. But it's a really shockingly hard concept for some boards and some even C-suite leadership to understand you need to make that investment.
Yeah, you need to make the investment, but I also think it's really important to recognize that it should be the right investment because, somebody would say to me, I want to run one advertisement, and I'd hand them the trash can and say, okay, we'll put your money in here because that doesn't work. And that's kind of the thing with boards. We'll run one and let's see how it goes. But no, it's difficult to get people to understand how important it is. But if you look at our world today, the ones that understand how important comms are the ones that you're hearing talked about all the time.
Absolutely. It's absolutely true. Whether you like the message or not, you believe in the message or not, it is messaging. Absolutely. And I appreciate you bringing that up because that's the lesson of the day. We don't have a lot of time left. I'm just been so fascinated to hear about your journey and in your leadership style. Let's talk about the future, which has got to be a little daunting given you are in the center of doing so much and achieving so much. What are your future plans and your growth goals? And I would want to start with you personally, being, so tied to the founding aspect of this. How do you see this journey continuing?
So our goal is we're at 10,000 Dwyer Scholars, and we've been funded since September of 22. And our goal is by 2030 to have 100,000 Dwyer Scholars in probably 20 or 30 states, and very achievable. We know we can do that. I'll be expanding my staff, and I have to scale my technology, and I have a lot to do to get there. But it's very achievable, and it's much needed.
Yeah, really interesting. Now, how do you see yourself personally moving through this? Have you invested in just even mentally invested in strategic planning for your next gen leadership or how the organization grows that leadership and that talent base?
Yes, absolutely. We don't do anything without a plan, and fortunately, I have a CFO that makes me stick to every plan he wants me to stick to. He's so that's fortunate for me because I run fast, and he keeps me, reasonable about running. But we've done our strategic planning. We know how much we have to expand the team. Um, you know, but I started this from zero. There was nothing that existed when I started this. There was nothing. So, it's all a work in progress. It's trying to figure out now when we're certain numbers of states where, when we have our partnership people, how do we set that up? Is it regional? And, so we have to think about structure, and it's a work in progress all the time.
Mm-hmm. Have you, and I know this might be like a little bit of a bizarre question, but how close have you been to these targets and these strategic plans that you set up? Have you been like surprised, like, wow, these things are coming to us more quickly and easier than we thought? Or has it been maybe like, wow, this is more of a slog and we need more investment? You know what I'm saying? Like, how does that level set for you?
It's worked. It's interesting. My first budget, though, I sat with somebody and I was like, let's put $500 on that. That was like their very first budget when we didn't have anything that existed. But we're very strategic about how we're spending our money. We get our directors really involved in the budgeting process. We haven't had any so far, so good. We haven't had any big surprises, but that doesn't mean it won't happen.
Well, I think it's fascinating, and we haven't even really touched on this, but you started a healthcare focused nonprofit during a global pandemic, which was highlighting the medical profession and staffing morning, noon, and night. It's just a fascinating period of time that you were in.
Yeah, and people were leaving the profession.
Yeah.
It's crazy. But one of the things I think that really impacted people was they did start understanding that the heroes in all of this were the healthcare workers. It were the doctors and nurses and certified nursing assistants and those people that kept showing up at work, putting their lives at
Yeah.
risk at times, that became the heroes. I don't know if you remember in New York, as people would leave the hospitals, the workers would leave. They, people, would clap for them and that
Yeah.
sort of thing. It is a very respected role in our society. So we are seeing people that are really interested in doing it. And, there's a lot more caregivers in our world than you would ever know.
Oh, I like that sentiment. I think that's a cool way to kind of wrap things up, because I fear for a country that is seemingly losing their empathy. And that's a frightening thing for me, just personally, looking across the landscape of the nonprofit sector. We have 1.8 million registered nonprofits in this country, all doing incredibly different things, right? Important things. And when we think about empathy, um, that is a central value to how we support nonprofits. I don't care if you're running an opera company or a museum or a clinic, right? It's, to me, that's kind of like the secret sauce.
It is. I agree with you. And I see it every day. The other thing is our world is challenging. We know that. And we had our Care Force Collective breakfast, our first big fundraising breakfast this morning, and we had
Congratulations.
some testimony. Oh, thank you. We had some testimonies from some of our Dwyer Scholars, we call them, and one was homeless with 4 children,
Mm.
nothing, nothing. Another was experiencing domestic violence, and I could go on and on. And every one of them are on their feet now and loving what they do, but they all are motivated by wanting to care for people. That's a beautiful thing.
It is. Yeah, that's super powerful. Well, I have really enjoyed this
Thank
conversation.
you.
And it warms my heart that there are people like you, and your team looking at a problem and understanding that there are solutions and that there are unique ways to go about it. And so, really interesting stuff. When we're off camera, I want to talk to you about my community. I'm
Okay.
just I'm just priming the pump here. But you must get pitched all the time, Barb. And you're a woman from the communications field, so you understand about pitches.
I
But
do.
I'm gonna pitch you when we're done. Barb Clapp. She's a great spirit. She's also the CEO of the Dwyer Workforce Development Program, and you can learn about their amazing work, where they're serving, how they serve, at dwyerworkforcedev.org. And like I said, take a look at that heat map, and you will see how they are growing their impact and with what they are doing. It's absolutely fascinating, and certainly a time in our history where we need to be thinking about this, because it takes time to fix it. You can't just draw attention to it and then solve it overnight with money. You've got to engage in this educational and training aspect. So super, super interesting work. Barb, thank you so much for being with us today.
Thank you, Julia. I really had fun. I appreciate it.
Good, good. Well, when I read, I'll just witness to you really personally. When I read your communications background, I'm like, oh, I got to step it up, because comms are, that's the real deal. So you got to step it up when you're talking to a comms professional.
You did great.
Well, thank you. Our presenting sponsors are brilliant in their own communications as well, and they include Bloomerang, American Nonprofit Academy, Staffing Boutique, Holdings Nonprofit Banking, Interim Executives Academy, Your Part-Time Controller, Fundraisers Friday, and JMT Consulting. These are the folks that are with us day in and day out, and we are very, very grateful for their role in our process. We end each and every episode with this mantra, and wow, it always frames up differently, believe it or not, for me each and every day. But when I'm saying this message in my closing today, I'm thinking about healthcare, and the message is complicated, but yet it's very simple. And it goes like this: to stay well, so you can do well.